is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice, one that provides personal, professional, and financial satisfaction.
Welcome to another episode of the Thriving Dentist Show. I'm Gary Takis, your podcast co-host. We have a detailed episode for you today. It's titled, A System to Follow Up on Unscheduled Treatment Plans. I'm looking forward to sharing some great strategies for you to help you successfully follow up with those treatment plans. These are treatment plans that patient has a need or want, but for whatever reason hasn't scheduled yet. I think you'll enjoy this episode a lot. Hey, before we get to that, though, two announcements to make. First announcement is that coming up in mid-May, not too far after this episode is published, we have our very last Thriving Dentist MBA live stream workshop. That is a 9-hour course spread out over 3 evenings. It's May 15th, 16th, and 17th, a Monday, Tuesday, and Wednesday evening, consecutive, 3 hours an evening. 7 to 10 p.m. Eastern time. Go ahead and do the time translation yourself, whatever time zone you're in. But in that workshop, I'm essentially going to provide you the equivalent of a business MBA for a dental practice owner. And I go through the 10 elements of a thriving practice. I go through the 24 systems of a thriving practice. And essentially, you'll have the equivalent of a dental MBA by completing that live stream workshop. Again, it's done live stream, so you attend from the comfort and convenience of your home or office without any travel expense or inconvenience. However, it's done live, so you can ask me questions. I run it more like a workshop than a lecture. And this is our very last one. We decided at the end of 2022 to sunset this live stream MBA workshop. However, we made that decision internally, and we had so many dentists reach out to us to register for one this year. And when we said we're not doing them anymore, many said, hey, would you consider bringing it back one more time? I'm sorry I haven't taken it. I procrastinated, and I will take it if you offer it one more time. So we decided, sure, we'd be happy to do that. By the way, I have updated it considerably because of all the nuances of practicing today, including how inflation is affecting us, infecting too. So come join us for that Thriving Dentist MBA workshop. It's very inexpensive. You'll get 9 hours of CE, probably the least expensive cost per hour of CE that you could obtain. We try to make it as affordable as possible. And again, to register for that, go to thrivingdentist.com/MBA and look forward to seeing you there. We do limit attendance because it is run like a workshop, so you won't want to miss this one because there won't be any future MBAs. We'll be doing more master classes moving forward, the shorter 3-hour format, but we won't be doing any more Thriving Dentist MBA live stream workshop. This is it. All right. Next announcement I have is we have a great guest contributor. She's a new contributor for us, Dr. Luba. She is from New York. And she's an endodontist that's going to share with you some very useful endodontic technique that will help you get better results. I think you'll appreciate her tips and her clarity in presenting those tips. I want to thank Dr. Luba for contributing, and she does a wonderful job. You're going to love this top clinical tip.
Hello, my name is Dr. Luba. I'm an endodontist practicing here in New York, and I would love to share a very important clinical tip with you guys. For me as an endodontist, the most important thing once we open up the tooth and locate the canals is obviously to get down those canals and to be able to clean them out all the way to the apex, correct? So in order to do that, I don't recommend taking a file and placing it, into the canal right away, but rather coronally flaring the canal first and shaping the coronal 2/3 of the canal, irrigating the canals, and then inserting a hand file and obtaining your working length. This is very important because if you put in a file before coronal flaring, you may not be able to get back in there. You may not be able to maintain your glide path So a glide path is basically being able to get back into your canal without having any issues such as ledges, or you can block yourself out with debris. So the steps are very simple. You open up a tooth, you find your canals, you make sure you found all your anatomy. And once you do that, I will usually use my orifice opener, and I will open up the canal 2/3 of the way. Usually they recommend, flaring it about 2/3 of the canal. And once I do that, I irrigate the canals, and then I place my 10K hand file to obtain my working length. And once I do that, then I can go ahead and use whatever technique I'm using. I usually use a crown down technique when I clean those canals out, or you can use a different technique. Whichever technique you use, the main goal is to be able to get back into the canal safely. And in order to do that, you have to maintain that glide path. You have to recapitulate, which means that you take your hand file and you go 1 millimeter past the apex in order to keep that apical segment clean, because we don't want debris getting in there, because if you have debris, then you cannot get back into those canals. And a lot of times we'll see people, struggling to get to their working length because they did not establish the proper coronal flare, they did not establish a glide path. Once you do those 2 steps, then instrumenting that canal becomes very, very simple. But if you coronally flare, it's like a tunnel. If you open it up coronally and you shape it, then it gets much easier to get to the bottom of that canal. So that is my clinical tip for today. I hope it helps. I wish you the best of luck. Take care.
Hello, everyone. Welcome to the Thriving Dentist Coaching in Action segment. Before we jump in, I want to take a minute to thank Dr. Luba for that wonderful tip on endodontic technique. Thank you, Dr. Luba, for taking the time and sharing your knowledge with us.
Yeah, and Aaron, I want to echo your sentiments. Thank you, Dr. Luba. So clear and sometimes a clarity when things are said in a direct manner. They really encourage us to take action. So, Dr. Luba, thank you for your contribution, and we'd love to have you back on the show with future contributions. Thanks so much.
I agree. Today's coaching in action topic is a system to follow up on unscheduled treatment plans. A system to follow up on unscheduled treatment plans. I am Naren, your co-host. Gary and I share mutual clients. We do the marketing. Gary and his coaching team focuses on helping these clients have the best year every year in every metric that they care about. And one of the systems Gary uses is this particular system that he's going to be talking to you about today, a system to follow up on unscheduled treatment plans. Why should you care about this system? A, because I know it works. I've seen our mutual clients literally transform the practice just with this one system alone. And 2, you're going to learn those techniques. Gary's going to get into some nuts and bolts, and he's going to get into those techniques. And the benefit to you is you will have more of your patients accepting treatment, more of your patients saying yes to treatment. Yes, we all want 100% of the patients saying yes, but that may not be possible. But what if it goes up by 5%, 10%, 20%? That would make a huge difference. So you're going to enjoy this. You're going to have lots of tips. So take down your pad and if possible, start writing notes. And if you can't because you're driving, then come back and listen to it again. Gary, take it away.
Yeah, and this would be a good episode for any of our listeners to play at a team meeting, especially with your admin team members, because I'm going to get into granular detail about this. Now, Naren, you mentioned it kind of in passing in your opening comment about in the perfect world, 100% of your patients would accept treatment. However, that's simply not realistic. But let's break it down a little bit. But by the way, I was first introduced to this topic 43 years ago by Dr. Omar Reed, and he made a comment to me. He took me under his wing as offered to be a mentor of mine, and he was we were walking through his office and he said, you know what, Gary, remember, this is 1980. Let's put it in a 1980 perspective. He said, Gary, you know what? Most dentists are file cabinet millionaires. File cabinet millionaires. Now, I must have had a look of bewilderment on my face. Remember, I was very young, just getting started in this profession. And honest to God, I didn't know what he meant. And I must have had a look, and he said, Gary, let me take a minute and explain that. I said, please do, Dr. Reed, because I didn't know what he meant. And go back to 1980 and realize that we had paper charts. Remember those charts, Naren? You don't remember those. Those are before your time.
I do remember it. Even now I see some doctors having paper charts. I don't like to see it, but I do see it.
Yeah. But back then we only had paper charts. And typically those went in storage cabinets, open faced, bookshelves where they went, the active ones, the ones that were coming in regularly, but the ones that, we hadn't seen in a while went into a file cabinet. And they kept those for a period of time. They had to keep them for a period of time for legal reasons, for records reasons. They couldn't just dispose of them. What Dr. Reed meant by that is if dentists could just get their existing patients to accept treatment that was recommended, their practice would quite literally thrive if they could just get their existing patients to accept recommended treatment. And that's what he meant by file cabinet millionaires. And he's absolutely right. Back in the day, we used to do unscheduled treatment plan reports, and you can still do those. And if you've been in practice for a period of time, it's staggering to see how much dentistry you've been presented that remains to be done. It will be over 7 digits. It will be millions of dollars if you've been in practice a period of time. Now, let's break this down a little bit. For symptomatic treatment, the patient that comes in with the toothache, and it's kept them awake for 3 nights in a row. This cheek is full of swollen out, beyond the confines of their cheek, and tears are rolling down their cheek. And you recommend, well, let's go to Dr. Luba. You recommend root canal therapy to take care of that toothache. If you don't have 100% case acceptance on that case, you might want to think about another career. I'm being humorous to lighten up the topic, but Naren, would you agree with me on that? If the patient's in pain and they're in your office and you can help them with whatever that is, you can help them with palliative treatment or perhaps an extraction, perhaps root canal therapy. If they're in pain and you can help them, if you don't get 100% case acceptance on that one, then something might be wrong.
I agree. I think those are what we call emergency patients, right? So anytime an emergency patient comes in, they want to come in right now because they're in pain. Right now, meaning literally, I'll drop everything else. I'll get into my car and I'll come here right now.
It is their number one driving force. It supersedes everything else on their list.
Exactly. Right? It supersedes even a wedding they might have that evening.
Everything. This now becomes a number one priority.
Yes.
In a way, I'll say something in a humorous vein. If everybody could show up in pain, that would not be bad, right? We don't wish that. We don't wish that at all.
If they're taking care of their oral health, then of course they don't have to come in pain. Yeah.
We sure have motivation, when the patient is in pain. So I'm not talking about those. Now let's talk about asymptomatic treatment recommendation. In other words, they have a need, but it doesn't hurt.
Right.
It doesn't hurt. So a common one that we still see today is the patient has old amalgam fillings that clearly are breaking down. You can tell by visual inspection. You can tell by radiographic inspection. You can tell by photographic inspection. Take pictures and you can see. However, it doesn't hurt. It doesn't hurt. And again, I'm not suggesting we remove all amalgam fillings. I'm talking about where you can see that those fillings are eroding and decaying, and they should be replaced for good clinical reasons. But because it doesn't hurt, the patient might say, well, doc, if it doesn't hurt, I'll wait till it does hurt. What should be your case acceptance on asymptomatic treatment plans? This is something that will benefit the patient, but it doesn't hurt. So we benchmarked this, and what we shoot for, with our clients is we look for, and I'd love to say 100%, but it's not going to be 100% of that. We look for 70 to 80%, 70 to 80, somewhere in that range, for case acceptance for asymptomatic general dentistry treatment plans, asymptomatic general dentistry. 70 to 80% is your goal. Now let's talk about a third type of treatment plan. This would be for ideal care, optimum care, comprehensive care. Perhaps you might use the term elective care. This is something that they could benefit from, but it isn't needed. Isn't needed. What is a good case acceptance? And what I'm doing here is I'm beginning with the end in mind, Aaron. The old, concept, habit number 2 from Stephen Covey.
Yes.
If we don't have a target to shoot for, then any result is okay. We have to have a target to shoot for. So the target for symptomatic general dentistry when they're in pain is 100%. The target for asymptomatic treatment plans is 70 to 80%. Now let's talk about optimal, ideal, comprehensive, elective treatment plan. I'm going to use an analogy here, Naren, for our listeners. I happen to enjoy baseball. I grew up in a baseball family. Happen to enjoy baseball. I enjoy baseball statistics. And if a baseball player who retires had a lifetime batting average in the 300s, let's say it was 360 lifetime batting average. Do you know what kind of label might be put on that baseball player, Naren?
Hall of Famer.
A Hall of Famer. They will make the Hall of Fame. And if we break that down, if they have a batting average of 360, that means they got a hit 36% of the time.
Right.
That means, out of,
100.
10 at bats, or out of 100 at bats, they got a hit 36% of the time. Now, if you look at it the other way, they didn't get a hit 64% of the time. And yet that person would be called a Hall of Famer. If you've got a batting average, lifetime batting average in the 300s, they're called. So I want all of our, I would agree, Naren, all of our listeners are Hall of Famer dentists, aren't they?
They are.
Yeah, they are. They're Hall, because, they're committing extra effort to benefit their patients. So I'd like to think that all of you as listeners are Hall of Famers. So if you want to be a Hall of Famer, we want a case acceptance for ideal, comprehensive care to be between 30 and 40%, 30 and 40%. The higher, the better, but between 30 and 40%. Now you have something to shoot for. But Naren, now let's talk about following up on unscheduled treatment plans. Because like Dr. Reed said 43 years ago to me, dentists are file cabinet millionaires. Well, all of our listeners are also and multimillionaires now because of time and the value of treatment. It's multi-millions of dollars, and we have to follow up. So I want to suggest a follow-up system using technology that is manageable for the practice and produces great results. Naren, sometimes the patient generally needs to think about it. They need to get home. They need to check their schedule. Maybe they need to review the budget with a family member, maybe a spouse or partner. They've got to review the budget. Does that make sense, Naren?
Yes.
They might have to think about it. So we need a system to follow up. And here's the system that I'm going to suggest. And it involves technology. So I'm going to ask you to do this in a spreadsheet format, I'm going to ask you to create a spreadsheet. This is what we teach our clients to do for every month of the year. So, the episode is coming out in April. So let's create a spreadsheet for April 2023, and we'll have a spreadsheet. And in the spreadsheet, we're simply going to put the patient's name, every new patient that we see during the month, every new patient, and it's just going to go, in order down the spreadsheet. So the first entry is the patient's name. The second entry is the date they became a new patient. So we'll start at the beginning of the month and go to the end of the month. The third column is a shorthand of the recommended treatment. And Naren, it doesn't have to be detailed notes. Maybe it'll say fillings upper left, fillings upper left. So Naren, let's say you're the patient and it's April 1st. So, here's Naren Raja. April 1st is the second column is the entry. Third column is fillings upper left. And then the fourth column is a place for your team member to enter digital notes when she follows up with Naren. And the final column is to indicate whether the treatment is scheduled or not. And if it's scheduled, we're going to put the date that it's scheduled. So maybe we do follow up with you. Maybe you say, Naren, on the day you came in as a new patient, okay, I'm in a big project at work right now. I'm going to need to take a look at my schedule, and I'll get back to you once I have a chance to check my schedule. And then we're going to follow up with you And then hopefully you're now scheduled to have that treatment, say April 20th. I'm making up dates. And if for whatever reason it's not scheduled, we just put no in that last column. And now what I want your team members, your admin team members to do is to have a goal to follow up with every new patient that month by the end of the next month. We have to have a little time go by. I want them to follow up with every one of those patients by the end of the next month. So in the example that I'm using, all the new patients in the month of April 2023, by the end of May 2023, doctor, I want you to have a scheduling meeting with your scheduling coordinator and review the spreadsheet. And the goal of your scheduling coordinator should be to have notes on every single patient that you saw in April by the end of May, because I want to follow up with them while the interest is still keen. Does that make sense, Naren? It kind of goes stale after a while. So while it's still active, and the goal is when they meet with you, and that's a short meeting, it takes about 15 minutes, depending on your new patient flow, could be 20 minutes if you have a lot of new patients, but we simply review that. And the goal is to have notes on every patient. The goal ideally would be to have everyone scheduled, but again, depending on what category they're in, is it asymptomatic general dentistry or is it ideal? The goal is 70 to 80% of asymptomatic general dentistry. And then the goal for comprehensive care would be in the 30 to 40% range. And maybe a note says it's optimal treatment and they need complex treatment. And maybe the note says, right now, budget doesn't allow to schedule this treatment, and they'd like us to follow up in a couple months. And that's an acceptable note, Naren. I mean, ideally, we want to say, yeah, they're ready to go and they're scheduled, on this date. But now by having that meeting, that meeting with your scheduling coordinator, you've got the efficiency of following up with these patients in a timely manner. And now I'm going to recommend that your scheduling coordinator use technology to follow up. Back in the day, the only way we had to follow up with people was what, Naren? Back in the day. What was the only
phone, right? Phone.
Right.
Yeah.
And even back in the day, you know what happened to most of those phone calls?
Voicemail.
We didn't have voicemail back in the day, Naren.
Oh, so you just hung up and you just called and nobody answered.
Answering machine.
Oh, I see.
And I know you're dating yourself, Naren, because you don't remember an answering machine.
No, I do remember when I was in university, we had answering machines, but I totally forgot.
They went to the answering machine.
Short period, yes.
Right. But they went to an answering machine. And we'd be playing phone too. Well, now what is pretty much everyone's preferred method of communication today, Naren? What's pretty much everyone's
text
message. So now we can send them a text message. Hey, Naren, this is Madi from Life Smiles Dental Care. I just wanted to follow up with you. I understand doctors recommended fillings for you on the upper left. I remember that you had to check your calendar. I didn't want you to slip through the cracks. I just wanted to follow up with you. Now, whenever we follow up, hit pause on that role play. Whenever you're following up with a patient, come up with a benefits statement. So it's not just I'm following up with you, but here's why. Naren, we know that if we can take care of these fillings now, we can take care of them conservatively before it becomes more complex treatment. I just wanted to follow up with you to get that taken care of when we can be as conservative as possible. Hey, you can message me back. Just give me a call back and I'll find an appropriate appointment time for you. So it's a we care call. I care about you. I'm checking in. I didn't want you to slip through the cracks. And you're doing it in a relatively timely manner. And very often, even if patients, here's what we hear routinely from scheduling coordinators in my client base. They tell me that many times, even if the patient isn't ready to schedule, ideally we want them to schedule, but we can't force that. They say, thanks so much for following up with me. So I would consider that a successful contact. Would you agree, Naren? When the patient says, thank you?
Absolutely. Yeah. I mean, they look at it as you're doing them a favor, right? Because you are a healthcare provider and they have some health needs that you and the patient talked about. And now you care about their health, that you are checking in with them to see, hey, how do we take care of this? When do we take
Yeah.
care of this?
And I think if you use a phrase to tuck in on your hip pocket, and a phrase to teach your team members is, we care about your patients. I didn't want you to slip through the cracks.
Mm-hmm.
That's a phrase that you can put on your hip pocket and use very effectively with whether it be in a text message or if you happen to call someone, but that can be used in a text message very definitely. And invite the patient to reach back out to you. And I can find a time for you that's going to work to schedule this. Now, there is an advanced version of this. You could have a link to real-time online scheduling, where the patient can actually schedule off of a link. We tend to use that more in hygiene, where the appointments available in hygiene are relatively simple for people to schedule, but there are offices that use that. One of the apps that is available for that, there's a number of them, but I like Local Med. Local Med is an app that allows the patient to do real-time scheduling. So you could say, if you had Local Med, you could say, Naren, you could call me back and I can find an appointment for you. Or you could click this link and find the one that works best for you. So use your judgment on that. We tend to use it more in hygiene because it's a simpler process to automate, but that's an option as well. And Naren, now, if you have a goal of having the entire spreadsheet for the month of April reviewed by your scheduling coordinator by the end of May, you're staying on top of it, and these follow-ups are not getting stale. And now we've got a great system. It's a proven system. We have this in all of our clients' offices, and we're seeing fantastic results. We're helping our patients maintain great oral health. We're helping them take care of things before they become bigger problems because it becomes more complicated. We're helping them utilize insurance benefits for a genuine need. I mean, it's win-win-win all the way around. So there's that system, and I encourage you to put it in place. It's simple, but it has some nuances that add some nice complexity, to your practice to make sure that we just don't do a one-time presentation and hope they schedule. That isn't a very good plan. Talk about it once and then, hope they schedule. This is a much better way to handle unscheduled treatment plans. Naren, let's hit pause on the coaching and action segment. I know we've got some great questions that have been pre-submitted by our listeners that'll maybe add us a little more texture, a little bit more detail to it as we go. Looking forward to the Q&A segment.
Hello, everyone. Welcome back to the Thriving Dentist Q&A segment. This is Naren again. Gary, I enjoyed the coaching and action segment where you talked about a system to follow up on unscheduled treatment plans. You gave some practical tips that perhaps the offices can implement tomorrow. So thank you for that. Now, I have 4 questions for you, Gary, from our listening audience, and I want to go through them one by one. Let me start with the very first question. Per your suggestion, I'm going to start to follow up system for unscheduled treatment plan, and I will start with the most recent patients. This is my question. How far back should I go?
What a great question. By the way, I totally agree with your priorities. Start with the most recent ones and work your way back from there. But let me say that using technology through text messaging, and I hope all of you have an app and a process to send text messages to your patients, it actually makes it pretty easy to go back and makes it efficient for team members to do this. If all we were doing is calling and leaving messages and then playing voice tag back and forth and phone tag, maybe there's a point of diminishing return on that. But as we're recording this, Naren, in 2023, we're recording this at the end of March in 2023. It's coming out in April. I would certainly go back through all of 2022 and try to reactivate those patients. I think it makes sense to go back even the previous year, 2021. And frankly, I think it makes sense to even go back to 2020 because, think about what happened about 3 years ago now, Naren, that literally, we'll never forget. Anyone that's lived through it will never forget it. It's when COVID hit and shut everything down.
Yes.
Every practice has patients that maybe you saw in January or February of 2020, or maybe late 2019, maybe in November or December of 2019. And then COVID hits and they can't be seen because your office is closed. And then for many people, they weren't ready to come back right away because of all the unknowns and uncertainties around COVID. And then life gets in the way. And meanwhile, the tooth is asymptomatic. It does, or whatever was recommended is asymptomatic. And they're just thinking, well, if it doesn't hurt, I don't need to do anything about it. So I would be willing to go back multiple years. Certainly, I would go back to 2022, 2021, go back to 2020. Probably a 4 or 5 years is as far as I would go back. And maybe at that point, we're just trying to get them back in for hygiene. Maybe if they haven't been into your practice since then, we're getting them back into a hygiene appointment. So there's my answer. Using technology, I think we can go back a number of years because these are people that have been in your office, hopefully had a favorable experience in your office, but then life got in the way. And maybe the follow-up is not necessarily the treatment that was recommended. Maybe the follow-up is getting them back in your practice for a hygiene appointment. Because if you've seen them in hygiene, you're likely revisiting the treatment plan in your hygiene exams. So at some point, probably if it goes back before 2023, we're reactivating not so much for the recommended treatment, although we will bring that up, but we're going to really reactivate them for hygiene because it's through that hygiene appointment that we're going to be able to do another exam and give them an update on that recommended treatment. But you can go back a number of years using technology and do it very efficiently through text messaging.
Thank you, Gary. Appreciate it. Let me ask you the first question. Like many practices,
second one, Derek?
Yes, second question. The second question, thank you for catching that. Like many practices today, I'm short-handed at the front desk. I don't want to give up on follow-up on unscheduled treatment plans. Any suggestions? So I guess what I'm hearing is it's like, I don't want this to fall through the cracks.
Yeah. And yet I'm shorthanded and I don't want to overwhelm my team members. I'm hearing that as well.
Yes.
And Doctor, my heart goes out to you on being shorthanded, and you're not alone. It's a dilemma in many practices today where there's an open position that's unfilled. And that could be in your admin department. It could be in your assisting department. It could be among your hygienists. It is a bit of the nature of staffing today. Now it's changing. We're starting to see positions that were open now filling. I'm not sure what's driving that, Naren, but I'm happy to see that even in hygiene, I have clients that have had an open position for a period of time, and they continue to post their ads and sort through inquiries. And now they're getting multiple resumes, and now they're able to fill positions based on more people, applying. So don't give up on applying. But to answer that question, you might look at outsourcing certain tasks that are sort of repetitive function type tasks that you could outsource. You could use an outsourcing service. For example, things related to dental insurance. You all know how I feel about dental insurance, by the way, but even if you are a fee-for-service practice, your practice still confirms eligibility, still submits claims, still does follow-up. You can outsource those. There are third-party service agencies that can do that kind of work for your practice in an outsourced manner. So I'd look at outsourcing. And then the other thing I would take a look at doing as well would be to allow the team members that you have some dedicated time that they could put their head down and actually work on following up on unscheduled treatment plans, work on sending those text messages out so they weren't being distracted. And I'm not going to suggest that it's easy, but I'm going to suggest there's a good ROI, a good return on that investment. By having your team members know that this is a high priority. See what else you might be able to maybe push downhill. Here's another solution. I'm just being creative here about thinking about solutions, Naren. Perhaps there's some rather basic tasks that you could hire a part-time team member. This person could even be a high school student, be a young adult that could handle some basic tasks in your practice. That we could have your team members push some things downhill to so that they can spend their time doing more high value activity like following up on unscheduled treatment plans. Does that make sense, Darren?
Yes.
Yeah. Any of those solutions could be, a temporary solution until you get fully staffed again. And I've seen those used in my client offices, and I've seen it used with success. For example, eAssist, is a service you can use that helps with electronic, everything related to claims submission, claims follow-up. There's others. I don't want to I don't want to exclude the fact there may be other sources for outsourcing, but there's any number of different ways you can outsource admin duties and outsource those very, very successfully. A friend of mine, I'll give her a shout out. She's been a guest on the show in the past. Mary Beth Bajornis has a company in Ohio called Dental Support Specialty, where they do outsourcing. They can outsource admin support for things that can be done with outsourced team members. And she does a brilliant job. You can Google the DSS, and I think you'd see great results. So there's some solutions there.
Absolutely. I think that is the trend, to fight these issues with staffing and whatnot. What can be outsourced, perhaps you should try to outsource it.
Yes.
Because trying to be good at everything is almost impossible. So you kind of focus on the things that you're really good at and let other people do the things they're good at.
Especially if they're routine and they tend to be sort of repetitive. And also they bring some expertise in terms of getting those things done efficiently. You bet.
Yeah, exactly. Let me ask you the third question, Gary. I have heard you talk about using benefit statements when following up. Can you provide me some examples of benefit statements I can introduce to my team?
A great question. And I always, whenever we're following up with a patient, I want to include a benefit statement of some sort, relatively short and to the point. But here's why you need to do this. Let's say we're reactivating a patient for past due hygiene, Naren. Now it's hygiene that they're past due for. We want to reach out to them. Naren, we've missed you. All this is in a text message. We've missed you. I'm reaching out to you to schedule your hygiene appointment. Now listen to the benefit statement. Naren, we know if we see you on a regular basis, we accomplish two things. We keep you as healthy as possible, and we reduce your future dental expenses. Naren, you can give me a call and I can find a great hygiene appointment for you, or you can click this link and make your next hygiene appointment direct online. But the benefit statement is, Naren, if we see you on a regular basis, we accomplish two things. We keep you as healthy as possible, we reduce your future dental expenses. So there's an example of a benefit statement. Another one would be those fillings, Naren, like we talked about in the coaching and action segment. Like the patient might even be thinking, I'll wait till it hurts. Naren, if we wait till that hurts, the treatment may end up being more complicated. It may end up needing a root canal and a crown. The patient may choose to wait, but now we can treat it more conservatively by simply replacing those fillings. And so use a benefit statement. And a common benefit statement is, if we wait, treatment may become a lot more complicated and more expensive. We'd like to avoid that if possible. So benefit statements like that. Now, there could be a very different benefit statement, Naren. What if the patient was interested in a smile? I'll use a different example. It's Linda, and she came in, maybe she's in her mid to late 40s. And one of the things she's interested in is having her smile done in time for her daughter's wedding. Now, I'm going to use a very specific benefit statement, Naren, related to her situation. Right. Linda, you mentioned to me when you were in that you wanted to get the smile done before your daughter's wedding, so you will look amazing in those wedding photos. Hey, I just wanted to follow up with you and get this done early because I know what it's like as it gets close to the wedding and things get kind of hectic. Let's allow enough time. And that can be very specific. And any way you can tailor the benefit statement to the patient, you're going to be a lot more successful. Now, Naren, let me use another example. I could go all day. Maybe we're going to do maybe we'll do a whole future benefit episode on benefit statements.
I love it, Gary.
But here's another one. This is often overlooked. Let's say the patient is in their early 60s, and the patient has said to you, they're counting down to retirement. They're counting down to retirement. And maybe they've even shared with you, I've got less than 3 years to go and I'm retiring. Okay, maybe we know that. When we follow up with George, we say, George, you've shared with us that you're on your countdown to retirement. Let's look at getting this taken care of while you still have what, Naren? While you still have what?
Your insurance.
Your dental insurance benefits.
Yeah.
And that goes for whether you're a fee-for-service practice or an insurance practice. You want to help them utilize their benefits. And I'll Guarantee you, Naren, that is not on many of your patients' radar screen. They're thinking about the cruise they're going to go on when they retire. They're not thinking about the fact that they're not going to have dental insurance once they retire.
Right.
Now, I wish they wanted to have the treatment done whether they had insurance or not. That's my ideal fantasy world, right, Aaron?
Right.
But why not use the leverage? That's a benefit. George might say, oh my gosh, I didn't even think about that. Yes, let's get this done. I have benefits. Let's use them.
Right.
So benefit statement, benefit statement, benefit statement, whenever you can tailor it to the patient. You know, in the case of Linda with the smile, in the case of George with insurance benefits. Maybe you know a patient that travels for work frequently. You know, David, with all of your travel, boy, it'd be good to get this taken care of so that something doesn't happen when you're on a trip relative to your dental health. Would like you to be able to, you know, go on your travels without worrying about your dental health.
Or even like a lot of people on Zoom, right? So if somebody says, I don't like my crooked teeth, or I don't like this crowding. Hey, I know you spend a lot of time on Zoom. This will make you look, you know, you want to smile even more when you're doing those Zoom meetings.
Well, we did an entire episode about what I think is the next wave of interest in cosmetic dentistry there. And in fact, we'll put a link in the show notes on that episode, but we did an episode about, you know, what could be the next wave of interest in cosmetic dentistry. And I'll give you the Reader's Digest version right here. Millennials. Right. 67% of millennials, those are people born between 1980 and 2000. So think about that group, have photoshopped an Instagram photo of themselves to improve their smile. 67, 2/3 of them. And this isn't just a little filter, Naren. You know how on Instagram you can do a little filter? This isn't a filter. This is photoshopped.
Edited the whole picture. They just moved things around.
And why did they do that? They didn't like their smile. They wanted to look their best on their Instagram photos. And so they're interested in smiles. So absolutely, there's another group that we can appeal to for sure.
Thank you, Gary. These are wonderful tips. And like you're right, let's do a separate episode just on benefit statements. I think that would
be a fun one.
We could do part 1, part 2, and part 3.
There might be a lot of them. You bet. At least we got it. We kind of nicked the surface on it right here.
Yeah, exactly. Let me ask you the last and the fourth question I have for you. It seems like my admin team members are often overwhelmed by checking patients in, checking patients out, and handling these numerous phone calls we get. How can I set up a system so they have dedicated time without distraction to follow up on unscheduled treatment plans?
What a great question, because that's very real. You know, I will tell you that the front desk in most dental offices is Grand Central Station. Sometime all your team members can do is check people in, check them out, and handle the phones. And even at that, it's overwhelming. And so I think a really good strategy is to allow your team members, your admin team members, to check themselves off of the front desk, off of the hot seat or hot seats if it's multiple, and go to a place in your office, have a back office workstation where they can work, they can put their head down. They're not going to be checking people in, they're not going to be checking them out, and they're not going to be on the phones. And they could put some dedicated time to doing the follow-up on unscheduled treatment plans. And that can be done for your doctor scheduling coordinator, your hygiene scheduling coordinator. And if they can check themselves off the front desk. Now, you have to make sure that it doesn't leave the remaining team members at the front desk overwhelmed,
right? You
know, because they're shorthanded. So if you can slide an assistant into that seat, train that assistant to do certain duties up front. And any dental assistant should be able to do these following 4 duties in your practice administratively. And now when we cross-train, we get a lot more efficiency. An assistant should be able to check a patient in, check a patient out, handle payment for everyday general dentistry, not necessarily the complex stuff, for everyday general dentistry. And they should be able to answer the phone for a potential new patient calling and get the same results that your rock star admin team members get as far as your conversion percentage, converting that call to a scheduled new patient appointment. Now, that's not going to happen overnight. It happens with training, but with training, your dental assistant should be able to do that. And that's what we do with our clients. And that versatility gives you a lot more flexibility, because maybe your doctor is back there, you know, with a long procedure, a long, more complex procedure, a high value service. And we have our second assistant available to slide up front that can allow your team member to go back and put her head down and work on following up on scheduled treatment plan. And even if she had 15, 20 minutes of uninterrupted time, that's going to be a productive use of that time. Well, Naren, as we come into the finish line, this has been a fun episode. I like the philosophical episodes, but I also like the granular detail episodes. This one fits in the latter camp, the granular details. Oh, and by the way, if you're a listener and you have done all the follow-up on existing treatment, then your need is for more new patients. And if you need more new patients, I highly recommend, Naren, your marketing agency, Equa. Any of our listeners can reach out through this link. Go to equa.com/MSM, marketing strategy meeting. The MSM stands for marketing strategy meeting. And you can schedule a marketing strategy meeting with Lila Stone, your director of marketing, that Lila can share with you a great plan for getting more quality new patients in your practice. On that note, Naren, let me thank you for co-hosting this episode. I also want to thank our listeners. We appreciate each and every one of you. I want to thank your team at Equa for supporting dentistry so well in the marketing world. Thanks so much. If you are not a subscriber to the podcast, if you're a listener but not a subscriber, hit subscribe to the Thriving Dentist Show. That means every Wednesday when we upload a new show will be automatically uploaded to your listening device. It's free. It can be done in any of your podcast directory devices, whatever your directory is. You can hit subscribe. If you haven't done that, that might be an easy way to make sure you never miss an episode of the Thriving Dentist Show. On that note, thank you for the privilege of your time. Naren and I look forward to connecting with you on the next Thriving Dentist Show.